How do doctors use imaging to diagnose rare bone tumors? When it comes to diagnosing rare bone tumors, doctors relying on a careful and systematic approach using various imaging techniques. Each method has its own strengths, allowing for a comprehensive understanding of the tumor's characteristics. The journey typically begins with a plain radiograph, commonly known as an X-ray. This initial imaging test is quick, cost-effective, and widely available. It helps identify suspicious bone lesions by revealing changes in bone structure. For example, X-rays can show areas of bone destruction, new bone formation, or calcifications. The patterns observed can provide clues about the tumor's aggressiveness and type. However, it's important to note that early-stage tumors or subtle lesions might not be visible on X-rays. Once a suspicious area is identified, doctors often turn to more advanced imaging techniques for a detailed evaluation. Magnetic resonance imaging, or MRI, is a key player in this stage. MRI offers high-resolution images that show the extent of the tumor within the bone marrow and surrounding soft tissues. It can visualize muscles, joints, and neurovascular structures, which is crucial for surgical planning. Different MRI sequences can enhance the visibility of the tumor, helping doctors assess its cellularity and vascularity. Computed tomography, or CORT scans, are also valuable. They excel at evaluating the bone matrix and can detect specific mineralization patterns within the tumor. This can help differentiate between various tumor types. CORT is particularly useful when MRI is not an option or when a clearer view of cortical bone involvement is needed. Sometimes, CORT is combined with positron emission tomography, or PET, to provide metabolic information about the tumor. In addition to these imaging techniques, functional imaging methods like bone scintigraphy, or bone scans, play a role. Bone scans can identify areas of increased bone metabolism, which is helpful for detecting multifocal bone involvement or metastases. The combination of PET and CORT is also becoming increasingly important, as it provides both anatomical and metabolic information, aiding in the detection of distant metastases or tumor recurrence. After gathering all this information, doctors integrate the imaging findings with clinical evaluations and laboratory tests. This comprehensive approach helps in determining whether a lesion is benign or malignant and guides the location for biopsies. It's important to remember that imaging alone cannot confirm a diagnosis. A biopsy is necessary to establish the exact type and grade of the tumor, often guided by imaging to ensure the most representative area is sampled. In summary, the process begins with plain radiographs to identify suspicious lesions, followed by MRI and CORT for detailed characterization. Functional imaging, like bone scans and PET CORT, helps assess for metastases. This multimodal approach is essential for accurate diagnosis, staging, and treatment planning for rare bone tumors, ultimately leading to personalized patient care. Always consult a healthcare professional for advice tailored to individual circumstances.